There are times when the axillary site is preferred over the oral site when taking a body temperature using an electronic thermometer. Use the axillary site for mouth-breathing patients and those who have oral inflammation or have had oral surgery. Also use the axillary site when taking the temperature of a toddler or preschooler with an electronic thermometer. These age groups are often uncomfortable having an oral temperature probe placed in their mouths. The axillary temperature is approximately 1 degree lower than the same patient's oral temperature. Be sure to note that you took an axillary temperature when documenting your findings. Sanitize your hands and assemble your equipment. Remove the thermometer unit from its storage base. Attach the blue probe, which is used for oral and axillary temperatures. Push the latching plug into the plug receptacle on the thermometer until it locks into place. Insert the probe into the face of the thermometer. Check to be sure you have disposable probe covers. Replace the box with a new one if it's empty. Greet the child's mother and introduce yourself.
Hi, my name is Kim and I'm going to be your medical assistant today.
Identify both the mother and her daughter and explain the procedure.
And this is Rachel Reinhardt.
Hi Rachel, how are you doing today? I need to take Rachel's temperature under her arm. Is that okay?
Yes, it is.
Has she ever had this done before?
Yes, she has.
Remove the clothing from the patient's shoulder and arm to expose the axilla so you can see where to place the thermometer. Check if the skin is dry or moist. If the axilla is wet, perhaps because of perspiration due to a fever, pat the axilla dry with a paper towel or gauze pad. Don't rub, as this friction can increase the surface temperature and distort the reading. Grasp the probe by its collar and remove it from the thermometer. This turns on the thermometer. Slide the probe into a plastic disposable probe cover until it locks into place. The cover protects the probe from microorganisms. Place the probe in the center of the patient's axilla. Instruct the patient to hold the arm close to the body. Hold the arm in place for small children or patients who cannot maintain this position. If the arm is not held close, air currents can interfere with the reading. Keep the probe in place until you hear a tone that indicates the reading is done.
Okay.
Remove the probe from the child's axilla. You will see the reading on the digital display screen in degrees Fahrenheit. Rachel's axillary temperature reading is 99.1 degrees Fahrenheit. Make a mental note of this reading. Discard the probe cover by firmly pressing the ejection button while holding the probe over the waste container. Avoid touching the used probe cover as it is considered contaminated. Insert the probe into the thermometer. This automatically turns off the thermometer. Return the thermometer to its storage base. Sanitize your hands and chart the results. Include the date, time, and temperature reading. Chart the symbol A next to the reading to tell the physician that this was an axillary temperature.